Hello everyone. I am Charitha Gangadharan. Uh, I work as a clinical research scientist at Miramai Health Analytics, Bangalore, India. First of all, let me express my gratitude to the conference organizers for inviting us and presenting our work at the 9th Global Insight Conference on Breast Cancer. The topic of today's discussion is screening performance of thermalytics, an artificial intelligence-based breast health solution in real-world community setting. We all know that breast cancer is the leading cause of cancer death in women. It is the same even in India. In India, one woman is diagnosed with breast cancer every 3 minutes, and one woman dies of breast cancer every six minutes. The mortality rate in India is almost 50%. One in every two women succumbs to breast cancer. So the question is, how can we reduce the mortality rate of breast cancer in Indian women? There also exists a disparity in breast cancer survival rates among the high and low income countries. In high income countries, the survival rate is almost 80 to 90%, whereas in low and middle income countries like India, it is around 60%, and in South Africa, it is around 40%. The 5-year survival rate is 40 to 60% in these resource limited countries. Why there exists a disparity in 5-year breast cancer survival rate? It's because in these countries, the cancer is detected at an advanced stage. In addition, there exist insufficient diagnostic or treatment facilities, and the health insurance coverage is very low. All of these act as barriers for early screening and detection of breast cancer and also cancer treatment. So currently the gold standard for screening is considered to be mammography. Screening by mammography has shown to reduce breast cancer mortality by almost 20 to 30%. However, in India, there is no systematic screening program. The current guidelines suggest that a combination of CBE, ultrasound, or mammogram can be adopted, and MRI in high-risk women. However, clinical breast examination is very subjective and can be efficient if they are trained well. CBE or clinical examination can detect abnormal lesions or lesions only when it is palpable, which means that it can detect cancers only at a stage 2 or above. And there is no proper governance that is happening for breast cancer in India. Though mammography is the gold standard modality recommended the world over, in India, there is limited availability of mammo units and also trained manpower, suggesting that it is less accessible and affordable in Indian settings or resource limited settings. In addition, mammography is proven to be low sensitive in younger women with dense breast, where the majority of Indian women are younger. Considering the limitations of mammography, many alternative technologies have been developed, including thermography. Thermography is a fast, non-contact, non-invasive, radiation-free method that generally measures the infrared radiation produced by the biological system. It mainly captures the heat pattern in the body. The principle is that tumor or the cancer undergoes continuous cell proliferation, and hence for its growth there is continuous blood supply to that abnormal region, and hence there is an increase in temperature that is being seen. Tumor cells also produce nitric oxide, which alters the microcirculation, and hence there is new blood vessels that is being formed. All the production of nitric oxygen, increased blood flow, all of these increases the temperature in that abnormal region, and hence there exists a temperature variation between the abnormal and the normal area of the breast, which is being captured by the thermography. This difference in temperature is being captured by the thermal cameras, and it provides as a thermogram as an output. FDA had approved thermography as an adjunct modality for breast cancer screening, even though there exist almost more than 500 thermography clinics in US. That was because it was actually reading the thermogram was actually a cognitive load, which means that identifying the area of abnormality when there is almost 4 lakh color pixels and 200 shades was very difficult for the thermologists. It is also a subjective analysis, and hence there could be a lot of interpretation errors that could happen. However, over the past 2 decades, much improvement has happened in the field of thermography. With the advent of high-resolution thermal cameras and AI algorithm to interpret these results, there are a lot of publications that has come up in the field of thermography over the last 2 decades. Hence, considering the limitations of manual thermography, we at Niramai developed a novel breast cancer screening solution using artificial intelligence and high-resolution thermal cameras called Thermalytics. Thermalytics is a medical software device intended for breast cancer screening. It is a novel fusion of artificial intelligence and works on the principle of thermography. This solution uses a high-resolution thermal sensing device to capture the thermal images, and uses a cloud-hosted analytic solution for analyzing these thermal images. It uses big data analytics, AI, and machine learning for reliable and accurate reporting. This is a very novel technology with CE marking and has 32 international patents, including 11 US patents. We have screened over 100,000 women so far in India, Kenya, UAE, Philippines, etc. It is also regulatory cleared in India, Kenya, Europe, and UK. Further, it is clinically proven to have better sensitivity than 2D mammography. The analytical engine of Thermalytics software is built on machine learning and deep learning methods. It involves 3 steps. Initially, the quality checks and image conversion, the segmentation, and then analysis. These features are being used to train machine learning models to compute a breast health score or breast health report. The procedure is very simple. It requires a laptop, a thermal sensor on a tripod stand, a cooler, and a rotating stool. It is a completely privacy-aware solution. As the participant or woman goes into a closed room where the technician sits outside and can share some of the instructions to her as to how she has to sit, what are the 5 different angles that she is going to take the images in, etc. After that, a brief session of 5 to 10 minutes of cooling session is being provided. And once the subject is sufficiently cooled, technician takes the images from outside the room and uploads it to the hosted uploads to the cloud, where the analytics analyzes the report, analyzes the images and gives a report, breast health report. So this is a unique experience and happens within 15 to 20 minutes. We have addressed several clinically relevant validated questions, and so far we have evidences to prove that thermalytics is clinically efficient in detecting abnormal lesions in symptomatic and asymptomatic women. It is also non-inferior to mammography. Thermalytics also work in women who have dense breast. Considering answering these clinically relevant questions, the question that we had was, in an Indian setting where majority of the population stay in rural and with a bigger population, can thermalytics perform, or how is it feasible for thermalytics to be used in a rural community setting? And hence, the objective of the current study is to evaluate the performance of thermalytics in detecting women with abnormal lesions in rural or community setting. So we had selected Maharashtra and Karnataka as our region of location. Nashik, Thane and Pune from Maharashtra were the districts we had chosen for breast cancer screening, and Bangalore from Karnataka. So the clinical protocol included to screen women above 18 years. The recruitment was carried out after they had given the consent. Excuse me. After consenting, the patient underwent thermalytics by a trained technician. If the report turned out to be negative, they were recommended to have routine screening. However, if the thermalytics test proved out to be positive, they were recommended for a further imaging evaluation either by USG or mammography. If the additional imaging investigation also proved positive, they were recommended for a histopathological evaluation. All of these were documented and used for data analysis. In this study, we had recruited almost 13,932 women. The median age of this cohort was 38. 625 women had proved positive for thermalytics test or test positive. The median age of this cohort was 35. Most of the women were in premenopausal status and they were asymptomatic. However, when in cohort of test positive or thermalytics positive, many of them were symptomatic. Women had presented with various symptoms, including breast pain, lump, nipple discharge, or skin discoloration. During the process of thermalytic screening, we had identified several abnormalities which were further confirmed by breast ultrasound. So 117 women had undergone breast ultrasound evaluation, of which 78 women had breast abnormalities. Some of the benign lesions, including abscess or inflammation, was the major finding. Many had fibroadenoma or fibrocystic disease. Some had galactosile or lipoma. Of the 78, 4 turned out to be malignant. This is a funnel to represent the whole screening cohort. 13,932 women were screened, of which 625 had proven to be test positive or thermalytics red, of which 117 had undergone further imaging evaluation either by USG or ultrasound, and if required, histopathological evaluation. Of 117, 78 had abnormal lesions, including 4 malignant lesions. So to conclude, the test positivity in this study was 4.5% with a PPV of 66.7. Thermalytics was able to detect abnormalities in 78 women, including 4 malignant cases. Women identified with breast abnormalities and were test positive or screened red were rescreened to ensure test positivity or thermalytics positivity and reduce false positives. Thermalytics is again, as I told you, it is a privacy aware, painless, radiation free, comfortable screening solution. And because of these patient friendly natures, it could be a favorable solution for population screening in India. And this could be one of the reasons for increased breast cancer screening uptake, possibly resulting in early detection and improved survival. Additional feature of this tool is that it can be fit into a small backpack and hence can be accessible anywhere, even in rural areas or even in the remotest of the places in India. So investigating the disparities in the follow-up after abnormal breast cancer screening can serve as the next steps to address the breast health disparities. Hence, thermalytics is an Indian solution for early detection of breast cancer for Indian women or women across the globe. It can detect cancer much before the lump is being felt. It is again a non-contact, non-invasive, privacy-aware solution considering the cultural context specifically in Indian women. It is an affordable and accessible technology, works for women of all ages and across rural or urban communities. Thank you. I am open for a few questions if you may have any. Thank you.